Thank you for tuning into our webinar today. My name is Jeff. We're going to go through this webinar fairly quickly. With me today is Rohit, our Brightsquid CEO, and Dr. Scott Wilson, who's going to take us through some of his terminal experience using it to help collect patient histories in advance. Before we jump in, Scott, do you want to just go through your disclosures really quickly?
So really, I'm a community-based neurologist. I do hold a position with the Department of Clinical Neurosciences at the University of Calgary in the Division of Neurology. So I do on-call work in the hospitals, but primarily have a community-based general neurology practice. I've been involved in IT for quite a long time, and currently sit on a committee that advises the AMA board about things IT related to the province. I do advise and teach residents on practice management in a larger venue for Jewel across the country and the Canadian Medical Association. And then I've been an advisor to Brightsquid for some time, and through acquisition of another company I was part of, became a shareholder. So that's my full disclosure. Next slide, I think we can go to. So, yeah. Well, there you go. You can see I've been using this since 2015, and have about 1,500 patients that I have invited. And it's a pretty slick and easy way to connect with your patients. And I was, I guess, ahead of the curve a little bit because I wanted to do something securely, realized that email wasn't secure enough, and decided to use Brightsquid to message my patients. And I started off looking at where I was having the biggest difficulty in terms of engaging the patient. So I looked at trying to collect as much information and engage the patient ahead of time. So we, sometimes it's 6 months, to see me, but I thought, well, can I do better with that? Can I actually get the patient engaged, get them to think about their problems? And so I have a lot of headache referral, and a lot of that is just history. And when a patient comes into the office, they sometimes really have to take time to think about, well, what medications have I tried? What haven't I tried? What's happened to me over a long, like 10 years of headaches or more, sometimes their whole lifetime. So I really was able to prime the patient a huge amount before the consult. And it was a much better discussion because they were accurate with the information. I could focus in on things that they may or may not have done, and then ultimately I was more in where the patients were more engaged, and the time to engagement was lessened. And then as well, when I could get through seeing the patient much quicker, which for me ultimately resulted in more patients being able or serviced in the day, if you want to. So economically better, but also better practically for the patients in terms of engaging them and not waiting so long for a neurology consultation. So I just went through and I developed a template, and I asked the patients kind of all the questions that I would normally ask in a routine neurological history, and asked them to fill that out. So one of the things that was interesting, if we sent that to the patient, the ones that responded right away were really interested in obviously engaging and seeing me as a practitioner. So it kind of actually, there was a little bit of a sorting or a natural selection whereby I could then, get to the people that responded right away. They were the most interested in moving this forward.
Scott, just on that note, I forget that it's been so long since you and I started working together, just in terms of getting some guidance about how the whole thing should work. It's an amazing process, because what we've seen is, while there was kind of a value that you were able to see in preparing the patients better, preparing all of that, I think what we've seen really in the last 12 months with COVID is it's not almost just about the history, it's almost about other questionnaires too. And maybe you would classify that as a history, but even just, the COVID messages and the COVID questionnaires that are going out ahead of attendance just cut down that much more uncertainty when the patients finally show up. I think, last month we had about 95,000 messages that were transferred over the system. and pretty dramatic results. You can only imagine if you're seeing 10 minutes from your history, what's the cumulative value that we're seeing across the system right now? It's quite amazing to think through that.
I would absolutely agree. And I think I started to take it even more so. Some of the other things like movement disorders. So people do have some odd movements, whether it's tremor or other things, even for epilepsy. And so, of course, you come to see the neurologist and you're fine when you're in there or something like that. It doesn't happen. So one of the things that I was able to do, because Brightsquid has such a bigger bandwidth, if I would say, or you're allowed to move larger files, then I'm just getting patients to video what's wrong and send it to me. And that's much easier than trying to do it virtually, because really it captures in the moment. So it's the best thing that we can do for a lot of neurology things. And then I can have some back and forth once I've looked at that in advance. And that helps me triage immensely what I have to do next then.
So interesting. It's something that I hadn't even thought through before we started talking about it. I mean, we saw a large increase in terms of dermatology, for example, which really is quite a natural progression, in terms of how to use virtual care, because those patients can take a picture of whatever the lesion is and send it to their dermatologist. Hadn't really thought through, the opportunity to take video and, as you've stated, it really capture the movement in the moment, which is difficult to reproduce, right? That's very interesting.
And the other thing. Oh, go ahead, Jeff.
I was going to say, there's certain things you have to see people for. You have to physically be present, but it's an interesting case where you can't time box a condition or an episodic event where, like you said, tremors, and there's limitations to a physical appointment that's synchronous, where you have to say, look, we've got 20 minutes together, you've got to make it happen now, or you have to remember everything now. And I like what you did about causing patients to think about their condition in advance. How many headaches do I have a month? Instead of rushing in, they're late anyway, they have to fill out a form and try and remember, their spouse isn't there to ask. It almost extends the length of the appointment beyond the actual point in time, while still condensing it, which I think is really interesting.
Yeah, the other thing that I was able to do, because often we do see something on an MRI or something, I can just take a screenshot without patient information in there, and then I can draw on it. I can actually put an arrow to what's wrong, and then add some text and send it back to the patient. So that's with your interpretation of results. I can actually take it, because I can send the report to the patient, and they can now get that with their My Health record, which is fine, but there always has to be some interpretation. And the visual, like a picture does speak 1,000 words. I could even argue it could probably even do it. It could probably even just, video some things on Netcare. It would be good enough to sort of show the patient their whole MRI sequence. But anyway, that's a whole other thing. But it really does that. And it is fast. It's was much better for me for follow-up of results. So I did have to change the way I approached it a little bit, but I felt totally safe and secure. And patients were very respective of, they wanted an answer as soon as possible, but nobody it gave them, I mean, they could answer at 2 in the morning or 7 o'clock, and sometimes I was answering at 10 o'clock at night, but that really, really helped. And now, it has gotten better with the ability to do that virtual care, with some of the fee codes that are now available through the Alberta Medical Association and our fee structure, although not perfect, and hopefully the AMA is working on that, or I know they are actually, because we were just talking about it today, but just for everybody out there. So, but it also allows me to deal with something and then move on and see the other patient that needs to be seen. So there's opportunity cost.
Really interesting.
Yeah, that's great. Well, I think, Rod, I know we've seen a lot of this sort of stuff. We've got a couple questions to get to. Do you have any comments on, the accelerated results, that sort of asynchronous communication and how else that's happening?
I look at the last, the sort of the pandemic change, and I think what we've started to recognize is that there's many better ways to communicate other than an in-person appointment, or with a patient, an in-person appointment, or maybe something they get in the mail, or a phone call. And there's better ways of doing that. As Dr. Wilson has said, there's a picture's worth 1,000 words. To be able to say, circle something and say, here's what it is. The asynchronous part of it means that it doesn't have to be done, between 9 and 6. It can be done whenever you have time, and the ability to include an image or include detailed results, which is, because of the condition, do this. It changes the opportunity for that communication for that patient, and certainly we've seen a dramatic change in that over the past year, I would say.
We do have a couple questions, and anybody else who hasn't had a chance to ask them, or when these come up, there is a question panel in your GoToWebinar control panel on the right side of your screen. You can type your answers in there. We'll get to as many as we can in the next couple of minutes. The first question really is something that comes out. I think how much extra work is a change like this in your clinic? Was it manageable, unmanageable, a big change?
No, I would actually argue it was kind of a relief. Last Friday, I tried to call 8 patients and I got a hold of 0 patients. So then I go to, if I have a connection with them, then I just connect through secure mail and can deal with it that way if I can't. It's harder with a newer patient. It's usually an established patient where I'm doing follow-up with them. And as a specialist, I don't always have that contact. So it's a little bit difficult. My staff are often initiating it, but that's one of the great things about the secure mail platform. It's all contained. There are patients on there. I mean, one of the things that we had all hoped that, it goes into the back end of the TELUS network. So you can actually look at other providers as well, which I have used when I know that somebody is there. That's a slightly different aspect to it. But anyway, in fact, it's great because it is simple to use. It's just like email, and once the patient is connected, then you have a record of their interaction.
Yeah, great. And then the other question was kind of addressed. I think one was about what about inappropriate use by patients. Have you had an issue with that?
I have not had any issue with that. Everybody's been very appropriate, and I can't even think in the 5 years where I've actually had to call out a patient. If anything, there's just a little bit of relief that they love the connection, and they're very respectful of it.
Great. And now this question, we have actually a webinar coming up about this, but and this is getting off topic, have you used secure mail in the realm of e-consultations or referral management interprofessionally?
I do. So with some of the spine surgeons at Calio, who I know are on the e-referral service, the fastest way to get an answer about if I have a question about an MRI is to flip it to them, and we go back and forth about things. So I do have colleagues. I really wish there was a widespread system of being able to do this. I think it would be so much better. I've wanted it for years. That's why I'm a believer in this. Like I would be open to be doing it. But sadly, we just don't quite have the bandwidth yet. So the easiest way was to go to the patient first and deal with that. But yeah, I do use it with other providers.
Great. Well, that brings us to the end of our questions and the end of our time. Dr. Wilson, thank you again so much for tuning in and providing your insight and your experience here. Any final words about your experience with secure mail before we sign off?
No, it's just it's so pleasantly effective and simple to use, and we all use email, we all use messaging. It's just taking it to a secure level with your patients.
Great.
Thanks so much. Well, thanks so much for your time, Dr. Wilson.
Thank you, guys. That's great.
Tuning in. And have a great weekend.